Good afternoon, my name is Rachel Flynn and I'm just going to give you a presentation on the National Patient Experience Survey. So the National Patient Experience Survey was a very successful partnership. It was the first time HIPPOSI, HSE and the Department of Health worked together, and basically what it's all about is actually listening to the voice of the patient and understanding from the patient's point of view how they're experiencing our services. And it's done in many countries, and it's been done for many years in many countries as well, but it has never been done in Ireland before. And very much we wanted to seek the feedback from patients from the 40 public acute hospitals. So what is it? During the month of May, if you were discharged during the month of May, you received a questionnaire and you were asked to participate in that survey. And it basically asks very basic questions from when you go into the emergency department to how you were treated there. Where you're treated with respect and dignity, and it follows you all the way through to your discharge and when you're discharged back home or to a nursing home. It is an internationally validated tool, and that's very important because it has been tested in other countries, and it really measures how patient-centred that service is. As I said, it follows stages of care through the hospital from when you come in to when you're discharged. So I suppose one of the reasons why you do a National Patient Experience Survey is to identify where things aren't so good, but it's also very important to highlight things which are good. And in the survey for last year, there was a lot good about our services. Something like 84% of people said they had a good or very good experience within the hospitals. They scored very highly in terms of respect, dignity and privacy, and these are just quotations from patients taken from the survey in relation to what they said. So again, the household staff who gave me my meals treated me with dignity and talked to me and expressed interest and concern about how I was feeling. One of the overwhelming things from the survey was the amount of people that commented on other staff, such as the reception staff, the ward clerk on a ward, the nurses, the porters, the doctors, but it's a community of staff delivering a health service, and we got lots of very, very positive comments back on a whole range of staff. The second area was around clear answers from doctors and nurses. And just to say then, like, this is a quotation from one of the patients said, the nursing staff were very attentive, helpful and caring. They always answered questions even though they were working in a very busy environment. And the last area then that the hospitals last year scored very highly was around confidence and trust in hospital staff. So again, just another quotation to illustrate that. I felt the surgeon communicated with me on a personal level, which gave me trust and built my confidence in facing surgery. We got a very, very good response rate in the National Patient Experience Survey. Over 13,000 patients responded to it, and we got something like 20,000 comments on the survey. And these range from a couple of lines to some patients actually writing 8 pages worth of commentary on their experience in the survey. Some of the comments were down the side. We had stapled extra sheets onto it, and we've analysed those comments, and they've been very useful and fed them back to the system in relation to improvement. In terms of then, I suppose, as I said at the start, one of the reasons why you do it is to identify how patients are experiencing the services in order for you to improve those services. So one of the areas was communication. Very much patients fed back that they didn't have opportunity and time to discuss their condition with a doctor. So again, a quotation to illustrate that, keeping patients and family more informed about what's going on. My children felt that they were told nothing and constantly had to ask questions. Involvement in decision making. Again, from the survey, what we found was that patients want to be more involved in decision making. They're not involved, and they wrote that in the written commentary, but also in the question that they responded to. And then, I suppose, a lack of information at discharge was another very key finding. I suppose it's a lack of information in terms of not having information on their medication when they go home, not knowing what danger signals to look out for. And this is just one of the comments then that we received from one of the patients. I had major surgery and was naive about the level of care and the effect that the medication would have when I went home. I live alone, and I feel this could have been explained better. So again, they would have put things in place if they knew this before going home. So I think with the National Patient Experience Survey, it's been, I won't say it's the easy bit of collecting the data. It has been a really group effort, and I look over there at the project manager, Tracy O'Carr. It has been a collaboration. It has been very successful. We've worked very good together with the department and the HSE. but really the success of any survey is what happens as a result afterwards. And the same day that we published our national report, which was last December, Leo Varadkar launched the report, we published a hospital report for each of the hospitals identifying what they needed to improve to make patient experiences better. And on that same day, the HSE published quality improvement plans. And I suppose quality improvement plans are key to the success of the survey itself. So one of the things that the HSE is rolling out, and from the survey we know that communication needs to be improved, is a communication skills training programme. Initially it's going to 6 sites, but the plan is to evaluate it and then it'll go to all sites. It's clinician led, so the clinicians are leading this, and it's about communicating with different disciplines within the hospital, but also communicating with the patient about difficult situations, bad news, breaking bad news, etc. This is, I suppose, an initiative in the Sail to Hospital group. We know that the information that patients go home with at discharge is poor across the country. That was a national finding, but it was a finding in almost all of the hospitals as well. And one of the simple things that the Sail to group, which is the group in Galway, are doing, and they cover hospitals from Letterkenny down to Galway, is that they developed a planning discharge booklet for patients that the patient sign and feeds into, and they basically developed this with their patient group, and they made them available to patients on discharge, and this is something that's been implemented as a result of the survey. These are just 3 very quick initiatives that I'll explain very quickly. First one is in Tallaght University Hospital. One of the things the patients fed back is that, the day before, usually patients filled out what they want for their meals. So if you were discharged, then you got that meal from the patient the day before. So now in Tallaght, they go with iPads to the bed of the patient and they ask, what do you want for your tea? What do you want for your dinner? What do you want for your lunch? And then they can, I suppose, discuss dietary needs, etc., etc. In the Mercy University Hospital, which is down in Cork, I suppose they developed a poster. It's about empowering patients to ask questions about discharge. So like you should be asking a set amount of questions about when you're being discharged. So what medication will I be on? How will I feel when I go home? That type of thing. And in Kerry University Hospital, they did the same thing around antibiotics. So a patient has a leaflet around antibiotics. It explains the antibiotic, it explains the side effects, it explains when you need to contact a doctor. So these are real initiatives that are going on as a result of the National Patient Experience findings. I suppose what next? We are, as I said, very successful partnership. We're committed to rolling out a 3-year strategy with the Department of Health and the HSE around improving patient experience. The easy bit is the collecting of the data. Reporting the data, that's easy too, but it's about making change in the services and constantly feeding back. So we've developed, we're in the process of developing a 3-year corporate plan, and part of that corporate plan is about developing surveys in more areas. So we're working with Declan in the maternity sector, developing a tool for the maternity sector, but we have had overwhelming, I suppose, engagement around other sectors, so cancer care, outpatients department, emergency department, primary care, mental health. So we've had lots of requests, and one of the things that we're going to be doing over the next number of years is becoming a centre of excellence, developing a competency centre within HICWA, because HICWA is the lead partner in terms of, I suppose, collating, developing the tools and, I suppose, managing the survey. We're also putting in an application to the HRB around the quality improvement initiatives. We very much want to develop a robust framework in rolling out quality improvement in Ireland. So we're partnering again with patients, with the HSE and with the department in putting an application in for that funding. I think the closing date is today, so hopefully we'll be successful in that. So that, I know it's only 5 minutes, I could talk all day about it, but I'll hand you back to, thank you.